want to say therapeutic massage. The difference between therapeutic massage and relaxation massage is that as a therapeutic therapist, you are a detective. You're trying to figure out, you're a problem solver. You're trying to figure out what their problems are and then target your treatment to the problems rather than just throwing them on the table and rubbing. Okay? Throwing them on the table and rubbing might feel good, but you're not going to actually start to make some corrections. So as a therapeutic massage provider, you're a detective, you're a problem solver. Everything that you're doing with them, you're gleaning more and more information to target your treatment to the right areas so that you can get much better effect. Again, this is called clearing of the hip, and the reason that we're doing this is why? Two things, two or three things.
Check range of
To
motion.
check range of motion and therefore increase it where we need to.
Mm-hmm.
What else? So we might find a limited range of motion. What else might we find?
Pain.
Pain, to find out where the pain is. How do we know if it's painful?
I'm gonna tell you.
What a genius idea. Perhaps ask the patient to tell you. So, Tamara, if you find any pain or if you feel like I'm stretching you further than you want to go comfortably, you say stop or point to where it hurts or make sure you communicate with me. Okay? What else?
You were talking about, okay, no, never mind.
Yep, spit it out. It might be good.
I was thinking straight leg raising to rule out,
Okay, we did
All
talk in
of
this, that's a kind of a whole different concept, but we did talk about possibly doing a straight leg raise test to see if she starts to get any numbness or tingling, which would indicate some kind of a sciatic nerve problem, whether it's an entrapment of the sciatic nerve from the muscles, piriformis and company, or whether it's irritation of the sciatic nerve because of a facet joint issue or a disc issue. So yeah, we could do a straight leg raise up and ask if she starts to get any numbness or tingling, okay? And if she doesn't get any numbness or tingling with that, we can also ask her to lift her head up and see if that causes any issue, and then back down. Okay, so if she did have issues with that, then when we do a hamstring stretch, we'd have to be very cautious because we'd probably start to get numbness like somebody I know. Okay, so that's a very good point. One other really important thing.
In a restricted range, you can stretch it then.
Yeah,
We already talked about
I
that.
already said that, that's right.
Oh, okay.
One other
It has
concept.
something to do with the corrections we're going to do on the back.
Oh, right.
Say that. So there's
Yeah,
2 points,
that's
because
right.
that's a really good
Yeah.
one too.
Yeah.
So we want to make sure we have the proper range of motion so that we can do the corrections that we're going to do.
Mhm.
There's still one more thing. When you assess anything in the body, what's one of the things that you're looking for? You want to
Evenness from side to side.
bonus. You want to
Oh.
you want to compare. You want to compare right to left. Okay, so if we find a restriction on one side, we want to go and see if she has the same restriction on the other side. So see if she's bilaterally imbalanced or just an imbalance on one side. Good. So those are the things that we talked about and you wrote down yesterday. So if you didn't remember, then maybe write it down today.
Yeah, well, I think our goals were to compare left to right, locate pain, perform S&F stretch, and try to overcorrect. So
There you go.
we've got
Yeah.
a lot more.
So yeah, and doing the overcorrection is another good thing. So we want to leave them actually with a greater range of motion than normal because we know that what's going to happen, the muscle memory, the tightness in the muscles is probably going to pull them back. So the best case scenario is if we actually overcorrect it and get them past normal range of motion because we know the elasticity, the adhesions in the muscle, the dystrophic changes in the muscle are going to bring it back and shorten it again because the muscle wants to go back to where it's used to.